Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, and welcome back to another episode of the Dance Physio Podcast. Thanks so much for being here. Today, we are going to talk about all things related to Turnout and really kind of the truth behind Turnout. So, hence the episode name. Turnout is probably one of the most common things that I get people coming into the clinic about who aren't injured, like people who are just looking at performance enhancement and how to improve their dancing. And little fun fact for you, I have a blog on my website that's all about Turnout, and it is the number one searched thing that brings people to my website who aren't local clients, like booking appointments. So I have a whole bunch of different blogs there, but the Turnout one is by far the most viewed blog and has been for quite some time. So Turnout's definitely a hot topic within the dance world, and especially I think with younger dancers who are up and coming and in their training, and something that there's still a fair amount of misconceptions about. I mean, knowledge around it has improved significantly since I was young and when I was training, but it is still an area that holds a lot of attention for dancers. So today we're going to dive in and talk about all sorts of different things related to Turnout. So like I said, it's one of the things that we see clients coming into the clinic, and when we're sort of okay, what are your goals, or what are you wanting to work on performance enhancement wise and things like that, improving their turnout is almost always the number one thing. And in the past, definitely 2 summers, but I would maybe even say 3 summers, but very specifically in the past 2 summers, I've had a lot of students coming back from summer intensive programs, and that's the feedback that they've been given by the programs that they've been at for the summer, is that they need to work on their turnout, and maybe work, quote unquote, in quotation marks. And so they're coming into the clinic and saying, okay, what can I do to improve my turnout? Because that's the thing that I've been told I need to work on in order to sort of improve my dancing or be considered for a year-round program, if that's one of the considerations from a summer intensive. So I think there's a few things. It's interesting because I feel like that's a trend that I hadn't noticed or we weren't seeing as much prior to that. And then recently in the last few years, it's definitely been something that's sort of cropping up more. And I have a couple of theories around maybe why that is, and I don't know if they're correct, but one of the things that I think we are seeing a little bit is there was a really big trend previously, and maybe when I was growing up dancing, and sort of carried on, and we still see sometimes in the dance world, but this trend of people kind of forcing their turnout or trying to over turn out compared to maybe what their own limitations or anatomy sort of is allowing. And there's definitely been more education and awareness in the dance world about problems that arise from people forcing their turnout. And I almost feel like the pendulum has swung a little bit in the other direction, where now teachers who, especially teachers who are really, quite careful in their training practices and really invested in dancer health and wellness, are really being super cautious about making sure dancers are not kind of cheating their turnout or forcing their turnout. But in some cases, what we're actually seeing is dancers maybe aren't using their full potential. And so it's like I said, it's almost like this pendulum swung in the opposite direction, where we have people who are maybe, underutilizing their turnout. And that's certainly not across the board. I still see dancers coming in who are forcing their turnout. So this is really nuanced because it's going to be individual for every dancer. I don't think we can necessarily look at a whole class of dancers and say, okay, all of them are forcing their turnout or all of them are underutilizing their turnout. But in some of the dancers who have come in to see me for sort of individual assessments, and when we've looked at it, it's actually quite possible for them to kind of increase the amount of turnout they're using because they've maybe been underutilizing it based on what their anatomy allows for. And in those cases, like I said, I think it's teachers who are being extra cautious, which is fantastic, but we also need to allow dancers to use their full sort of capacity. The other thing that I think we're seeing, and this is maybe a little bit more controversial and just my own opinion, is it seems to me like especially big companies, so like dancers who are going off to like, summer intensives at big companies, are almost using Turnout as, I don't want to say an excuse, but it's like the easy answer to give a dancer about why they're maybe not going to be accepted into that program if they are auditioning for like a year-round program or those types of things, or auditioning to get into the company or what have you. It's, one of those things that not very many dancers can sort of, I don't know if fight back is the right terminology, but can kind of dispute that, because there's sort of this ideal still within especially the ballet world that like more turnout is better. And so if a company tells you, oh, we want you to go work on your turnout, there's not much a dancer can do or say about that versus some other things that maybe historically, I mean, back in my day, and thankfully this doesn't happen as much anymore, although I know it still does happen, but there used to be much more comments about like dancers' body shapes or sizes or things like that, where it wasn't the sort of like quote unquote ideal ballet body. And now, companies are realizing that those types of things are not okay to say. So Turnout has almost become this easy thing to be like, oh, well, let's just tell them that they need to work on their turnout. So again, this is just my opinion, and based on like some of the dancers that I know and work with who have gone away and gotten this sort of feedback, is it does seem like it's maybe a little bit of an easy out when they want to sort of like let a dancer down gently, if you will, as opposed to kind of destroying their like whole morale or things like that. It's like, okay, well, here's this tangible thing that you can go work on. So if we back things up just a tiny bit, there's still this, I would say, ideal within the dance world, or this like idea or thought that like dancers want to attain what we would call or consider flat turnout. So that like 180 degrees, like toes pointed directly to the side sort of ideal. And if you ask people, and even when I go in and do workshops with students and we talk to them, like intellectually dancers know, and teachers know for sure as well, that that is not necessarily possible for the majority of dancers to achieve that 180. But aesthetically, when we're watching dancers, or like I said, like in these sort of like bigger company settings, and when they're looking at dancers, even though they may understand that most dancers can't achieve that 180, it is still, I think, ingrained that is like aesthetically kind of what we're looking at trying to achieve. And so this ideal kind of persists, even though we know, at least from an anatomical perspective, the vast majority of dancers are not necessarily going to be able to achieve that ideal 180 degrees of turnout. So, like I said, things are changing. Things have changed over the years. There's definitely more acceptance of this, like not necessarily being able to get to 180. But I also think there's more work to be done in terms of being able to look at dancers and look at lines that are being created and being able to like appreciate them for what they are, and not still seeing the kind of like lack of, that kind of flat turnout or that flat ideal of turnout in through there. So the other thing that I think there's much, much, much greater understanding of now than, again, there was like back in the day, is kind of how turnout is generated, or where turnout is even coming from. So, before, and you still hear this cueing even now, and it's something that some teachers I know have worked to correct, but if you go into especially like younger kids' dance classes, you'll still hear it, is we still instruct dancers to turn their feet out. And that was definitely, I think, instructions I was probably given when I was a kid. And if you go into kind of baby ballet classes, they'll talk about making pizza slices or things like that. Like, and it's this like very much idea of turn your feet out. And for really little kids, maybe we need to have that sort of like a visual of like they're like pointing their toes outwards or pointing their feet. But we now know, we've known for a while, but now there's a better understanding within the dance world that like turnout really is a whole lower limb phenomenon. So cueing that I prefer to use and prefer to hear teachers use is like turning your leg out or turn your legs out, as opposed to turn your feet out, so that it's much more of encompassing that whole lower limb. Because when we actually look at the breakdown of where turnout comes from, the majority of it comes from our hips. So this is going to vary in individual dancers, obviously based on individual anatomy and things like that. But about 60%, or in some people even a bit higher than that, sort of like maybe 65% of our turnout will come from our hips. And so really when we're telling kids to turn their feet out, we've taken all attention away from like higher up in their leg or even from their hips. So that's just something to think about if you are a teacher, or even if you're a healthcare provider and you're working a lot with dancers, like what terminology are you using when you're asking dancers to achieve certain things? So we know about 60% of turnout comes from our hips. Then the next highest contributor to turnout, so anywhere between potentially 20 to 30%, again, it's going to vary person to person, is going to come from our foot and ankle. And so our feet and our ankles have the ability to sort of create some of that external rotation through mechanisms like pronation and things like that that are happening lower down in the kinetic chain. And then the remainder of our turnout, so whatever's left, again, depending on a person's individual anatomy, is going to come from either the knee joint. We have a small amount of torsion that can happen at the knee joint. It's not a lot, but there's a little bit there. Or from something that we call tibial torsion, and that's the amount of natural curve or rotation that might be present in somebody's like shin bone. So you'll have some people who, if you are looking at just kind of like where their feet hang. So if you imagine a person sitting on a chair or like sitting on a table or something where their feet are dangling and they're just kind of like swinging their legs back and forth, and then they stop and their legs are just like naturally hanging. Some people's feet are going to hang sort of straight forward. Some people's feet might hang with their toes very slightly toed in, and some people's feet might hang naturally with their toes slightly toed out. And that can give you an idea of how much potential torsion there might be in that lower leg or in that tibia in through there. And what we see is people that naturally have more tibial torsion, like external torsion, so into turnout, they're actually going to be able to get more of their turnout from their lower leg than a dancer who either has more neutral or like a more kind of internal rotation happening there. So this idea that like the majority of our turnout should be happening from our hips is true, but it's also incredibly individual depending on every dancer's unique anatomy. And then even within that, we see varying amounts of sort of quote unquote natural turnout that happens specifically even at the hip. And so there's a lot of different sort of joint morphologies that we can see, or like the shape of the hip, that can contribute to either naturally having a little bit more turnout or naturally having a little bit less turnout. So the three biggest contributors in terms of like variations in hip morphology are something that we call the femoral neck angle. So that's the part of the femur that kind of attaches into the hip socket, if you will. And generally a femoral neck angle is somewhere around 125 degrees-ish. But if you have somebody who has a little bit of a sharper angle there, or somebody who has a little bit of a more shallow angle there, that can influence how the hip joint moves. We see this influence from the like femoral neck angle more so when we're looking at the legs in higher levels of elevation. So if somebody's just standing in, say, first position, this might not affect their turnout a whole lot. But if that person is trying to, do a développé, for instance, or get their leg up higher, this might influence how much mobility and specifically how much turnout is happening at the hip socket. So we have the femoral neck angle that can contribute to sort of how much mobility we have at the hip. We also have something that's called femoral version. And so what that is it is the angle of how the femur attaches into the hip socket in sort of like an anterior posterior direction more so. These are kind of hard concepts to explain like on an audio medium, but there's lots of visuals, like pictures, that will help you kind of understand it a little bit more. And actually, I did an Instagram post on this ages ago, maybe a couple years ago, but I'll see if I can link that in the show notes just so you can see sort of visually what we're sort of referring to when we talk about these things. So femoral version, we either have what we call anteversion or retroversion. And people who have a more naturally anteverted hip are going to naturally have slightly less turnout coming from their hip socket. And somebody who has slightly more retroversion at their hip is going to have slightly increased amounts of turnout just naturally when their leg or their hip is kind of in a resting position in through there. So again, this is just the shape of how people are kind of designed and built, but it's important that we know so we can understand what individual dancers are kind of working with and how they're kind of built. The third thing that really impacts mobility at the hip is our hip socket depth and the orientation of it. So with the first two things we were talking about with the femoral neck angle and femoral version, we're more looking at the femur, so the leg bone and how it attaches into the hip socket. But we can also have variations in the hip socket itself. So the hip socket sits on the side of the pelvis, and some people have naturally really deep hip sockets, and some people have naturally much more shallow hip sockets. And that is going to influence how much mobility you have. So the people with a shallower hip socket are naturally going to have a more mobile hip. The trade-off for that, or sort of the downside of that, is that they have a lot less stability in that hip. So they potentially are more likely to have like labral injuries or develop hip impingements or things like that because stability can be challenging for them. Whereas the naturally deeper hip socket, they may not have as much mobility, but they have a much more solid joint structure. And so they're less likely to have some of these stability-related issues in their hip socket. We also see variations in like the orientation of the hip socket on the pelvis bone. So some people's hip sockets face, essentially straight out to the side. Some are angled a little bit more forward. Some are angled a little bit more like to the posterior. So there's so much variation that can happen within that hip socket and then femur, kind of like the hip joint morphology or the shape of that hip joint that will influence how much turnout or how much mobility a dancer might have available to them. This is also why we see some dancers who seemingly have more turnout in certain positions than in other positions. And the classic example of this is a dancer who, say, standing in like first position or fifth position or legs on the floor, and they'll feel like they're like kind of a little bit rotated, a little bit restricted in that position. Like they'll just feel like, okay, this is as far as I can turn out. And as soon as they start to bring their leg up, so their femur starts to come up into elevation, so coming into, say, a passe or a retire type position, they actually feel like they have more movement available to them. And that's because they truly do have more movement available to them. So there's definitely hip socket structures that vary depending on whether the hip's in a more neutral position or if the hip's bent up to, say, 90 degrees or above 90. That can influence the amount of mobility. And so, again, this isn't something we're necessarily going to change about a dancer, but if a dancer understands that, they can learn to work within the range of their own hip socket, or we'll often refer to it as like finding the plane of the joint or finding kind of like that natural movement. So it may be that as they come up into a passe position, they can really open their knee up and come into a more turned out position. But as they bring that leg back down, as they're sliding back into, whether it be fifth or first or whatever, there's going to be a natural amount of kind of like internal rotation or a loss of turnout that happens. And for some dancers, we may need to allow that to happen. It might be physically impossible for them to maintain that same degree of turnout in different positions of the hip and the hip socket, depending on what their actual anatomy of that joint looks like. We also have ligaments that surround the hip joint. So, there's a hip joint capsule and it's made up of a bunch of ligaments. And in the case of the hip joint, they're quite strong, or they should be quite strong, robust ligaments. And so depending on what somebody's general mobility is like, if they fall more towards the kind of like more hypermobile side of the spectrum or more towards the more hypomobile side of the spectrum, we're going to see changes in the amount of movement that might be available, not just at the hip joint, but also, say, potentially at the knee or the foot, at the ankle, or other areas that contribute to turnout. So overall amount of kind of, I'll say, generalized joint mobility that people have is going to affect the amount of turnout that they're able to access. So if we move away from talking just about kind of the mobility part of turnout, we also need to be able to access the turnout that we do have. And so this is the more active part of things. This is where the sort of muscles come into play. And this is where we have probably the most ability to influence or to affect people's turnout. Because what we see commonly, or what I see commonly in the clinic, is that dancers don't always have a really great understanding of how to access and use the turnout that they have available. And this is what I was referring to sort of in the beginning when I was saying that there's dancers who are maybe underutilizing the turnout that they have. If we actually assess their hip joint mobility, they may have like quite decent hip joint mobility and sort of fairly decent turnout when we're assessing it, because we will actually look at kind of measuring those types of things in the clinic using, goniometers and things like that. But then when we actually look at, okay, how are you recruiting your turnout or how are you accessing it, we'll see some sort of inefficient movement patterns often. And so this is where there often is room for improving a dancer's turnout, is really optimizing how they're accessing their turnout. So back in the day, and I mean, I still get people coming into the clinic occasionally who are getting this cueing in class, but I would like to think that this cueing has maybe mostly gone by the wayside. The cue to get people to turn out was often just to squeeze your butt. And so you'd get teachers who would come around and, like, even back in the day when this was sort of considered acceptable, I'm not sure why it was, but they'd come around and kind of like poke on our bums and be like, okay, you need to squeeze harder, it's not hard enough, and things like that. And so really the cueing for sort of like creating turnout or holding turnout was just like glute activation. Are you squeezing your butt? And squeeze it. If you can't hold your turnout or you're losing your turnout, just squeeze your butt harder. And we now, or I at least now know, and sort of the dance world hopefully now knows, that this is really a super inefficient or not efficient at all way of trying to access and train turnout in any sort of dancer. So when we actually look at, okay, where should our turnout be coming from, or how should we be sort of achieving this, there's two sort of groups of muscles that we consider our turnout muscles. So we have muscles that we would consider our primary turnout muscles. So these are muscles that their main job is to do hip external rotation, so turning out from our hip, and they don't really have any other functions within the body. So they can't really do anything else other than laterally rotate or externally rotate our hips. So you'll sometimes hear these muscles referred to as like the deep six, or like the six rotators, or the deep rotators. They get called all sorts of things. It's a group of six muscles. I don't think it's necessarily important for teachers to know the name of every single one of those muscles. I think they need to know where they are. So if you're not familiar with these six deep rotators, I encourage you to go just Google like deep hip rotators and look at some Google images and see where those muscles are and how they attach from the pelvis into the femur, like into the hip, and how they create that external rotation. Because those should be the muscles that are our primary turnout muscles, because that is the only action that they can do. We also have muscles that we call secondary turnout muscles. So secondary muscles in the body are muscles that have a primary job, and then they also have sort of a secondary function. So an example, and I'll give you a few examples of these, but an example of a secondary turnout muscle would be your glute muscles. So the primary function of our glute muscles is hip extension. They're a power muscle that helps us powerfully extend our hip. They also happen to be able to create lateral rotation. So if, and in the case of how turnout was sort of trained back in the day, if we are asking the glutes to be the primary thing creating external rotation, there's very little capacity left over for the glutes to be able to do their primary job, which, like I said, is hip extension. And so hip extension becomes really important for jumping. So if we want power in jumps, or we want to get our leg up, especially behind us, so into like an arabesque or anything going posterior, attitude, anything like that, we need our glute muscles to be primary hip extensors, and then maybe they can help a tiny bit with turnout. But really, they should not be our primary turnout muscles. So glutes are considered a secondary turnout muscle. Our biceps femoris, so that's the outer part of our hamstring muscle, just because of its orientation of how it attaches from the pelvis into the knee, it can create a little bit of that lateral rotation as well. Sartorius is an external rotator as well. It comes, for those of you not familiar with the anatomy, it comes from our pelvis and crosses the front of our thigh and attaches to the inner knee. So it kind of is like a diagonal across the front of your thigh. And that is an external rotator, and especially with your knee in a more bent position or when your leg's coming in front of you. So think attitude devant. That's a really big muscle for that. And then our adductors, so our inner thigh muscles, again, their primary job is hip adduction, adduction, but secondary function is some of them can create some external rotation, again, depending on what position your leg is in. So those adductors as well are one of those ones that you'll often hear teachers refer to as like, holding your turnout with your inner thighs, or like turning your leg out with your inner thighs. And although they can assist with turnout, they are not our primary turnout muscles. So when we're looking at training turnout in dancers, what we're really looking at is making sure that dancers understand how to recruit and how to utilize those deep hip rotator muscles, those primary hip rotator muscles, because that's really where sort of the magic lies, but also where the room for improvements is. Because if we look back at what we were talking about in terms of like structure of hip joints and just our generalized like amount of mobility we have and things like that, those are things we're not necessarily going to change in our body. Like that is how each person is individually built, but our ability to utilize that mobility available comes down to muscle function, and that we can have an influence on. So one of the things that we see in dance is what we call a differential between active and passive turnout. And I'll explain kind of what that means. So when we talk about passive turnout, that would be like somebody taking the leg and turning it out and the muscles are totally relaxed. And this is one of the ways that we assess turnout, and one of the ways we measure it in the clinic is we'll actually look at, okay, if that person's totally relaxed and then me as the clinician is rotating or externally rotating their leg, how much mobility do we have available there? And so we get a measure of, and can make something up arbitrarily, but if we're looking at one leg at a time, a common measure we might see might be like 65 to 75 degrees of rotation on a single leg. We can then look at actively what a dancer can sort of produce. And so we usually use sort of frictionless ball bearing disc type things to measure this. There's other ways of measuring it as well, but we'll ask a dancer to kind of like, rotate their leg out. So, into first position, standing on discs or things like that. And we can measure that. And what we'll often see is there's this differential between the number we get when we passively measure it and the number we get actively. And so again, if we're going to use a number of like, let's say we see 65 degrees passively, we might see 55 degrees actively. So there's that 10-degree differential where a dancer's not truly using their full turnout potential. And so if we can teach them how to access their deep rotators effectively, if that's maybe something they're struggling with, or in a lot of cases, it's really just actually working on strengthening those muscles. So some dancers might actually be okay at recruiting them, but when we actually look at like, okay, how strong are these muscles? How much endurance, like how much can you use these muscles? They fatigue really easily. And so if you think about a dancer needing to use their turnout muscles for like an entire class or an entire day of rehearsals or shows or things like that, they might be lacking in endurance in those muscles. And so then we can look at actually working on whether it be strength or whether it be endurance to really increase the amount of active turnout that they're using, because in an ideal world, we want dancers to be able to use 100% of their turnout. So again, if we tie this back to the idea at the beginning of there was this like ideal of 180 degrees, we know that that is a false ideal. We're not going to get dancers there. But if dancers know how much turnout they individually have, and so a dancer's like shooting for, let's say 155 degrees of turnout with both legs combined or whatever it happens to be, if we know what they are anatomically capable of achieving, then we can have much more realistic targets of like, okay, is working on turnout something that is like an appropriate goal for this dancer or not? Because we have dancers coming into the clinic, like I said, all the time, and their goal is, oh, I want to improve my turnout. And in the vast majority of cases, that's a super reasonable goal because we'll see that differential. So there's that room for improvement. But there are cases that I have who come in who, when we actually look at passively what's available and actively what they're utilizing or what they're able to use, they're really already maximizing the amount of turnout that they have, which is, like I said, less usual. We don't see that as commonly, but if that is the case, then giving that dancer a goal of improving their turnout is really not an appropriate goal to give them, because there's probably isn't a whole lot of improvement that we'll be able to see with that dancer that is going to be safe for them to achieve. So then we get those dancers who start to kind of push into more unsafe sort of practices of really trying to stretch into unsafe positions or things like that, or stretch out their ligaments, or things that have these like permanent consequences that potentially are going to lead to injury or issues later on in life. And so knowing an individual dancer's turnout and their potential for turnout is really, really important, so that we're not just across the board giving that same advice to every dancer. Because if there's a dancer who is already maximizing their turnout potential, then we need to give them other things to work on. Turnout is not the thing that's going to like continue to push their dancing if they're already kind of maximizing that. Like I said, we don't see that very often, but I do see it occasionally. So for most dancers, working on turnout is a totally valid goal, but for some dancers, it's not. And for the dancers who it is a valid goal, it's most often or almost always going to come down to really working on understanding how to use their turnout muscles effectively, and then working on strength of those, as opposed to kind of stretching practices or things like that we'll see where dancers will come in and say, oh, I need to improve my turnout. I want my hips to be more open. Can you give me stretches to do? And in most cases, that's not going to be an appropriate approach to that. What we really want is for them to maximize using the turnout that they already have available to them with their own individual anatomy and morphology. So I hope that you have found this episode helpful in terms of understanding a little bit more about turnout and where it comes from and how we utilize it and things like that. I know that one question I am absolutely going to get, because I get it all the time, is how can dancers sort of find out like what their turnout is and that sort of thing, or how can teachers look at that? And in all honesty, unless you have ways of measuring it, it's pretty hard to sort of have a really good idea. Like sometimes teachers can kind of look and say, oh yeah, that dancer has a lot more turnout available that they're not using, or that sort of thing. But if we're truly looking at, okay, like, is there a lot of potential to improve this dancer's turnout? Oftentimes they do need an individual assessment so that we can truly look at, okay, what are the shape of their hip sockets? Like, where's their mobility coming from? So if you have dancers where that is an area where they're really interested in improving, or potentially an area that they're struggling with, I do encourage them to try to reach out and see a dance-specific practitioner, like a dance-specific physical therapist, because it really does need to be assessed on an individual level. So if you have more questions about that, feel free to reach out to me. You can send me an email or DM me. I'm happy to try and connect you with practitioners in your area and that type of thing. But I just know that that is a question that I will get after this episode, because anytime I do anything about turnout, it's always the question we get is, how do we find out how much turnout we have? But like I said, I hope that that was helpful to you. If you did find the episode helpful, I would love it if you would leave a review or a rating, preferably a review if you are so willing to. Actually, having written reviews is really helpful, as opposed to just kind of the ratings, although ratings are also really helpful as well. And even more so if you have a somebody who you think would benefit from this episode, whether it's a dancer in your life or whether it is a teacher, colleague, friend, anybody who you think would find this helpful, I would be so appreciative if you shared it with them so that the whole dance world can understand a little bit more about turnout. Thank you so much for listening, and we will see you back next week.